Hi, my name is Jessica, and this is my final presentation for the class Health and Aging. To begin, I would like to discuss access to healthcare for older adults. Not everyone has equal access to healthcare, and these disparities can be driven by socioeconomic status, living in rural geographic areas, and rising healthcare costs. Healthcare disparities disproportionately affect older adults. This is an issue because older adults often have a need for more care due to being at an increased risk for things such as chronic health conditions, such as arthritis, heart disease, high blood pressure, diabetes. Older adults are also at an increased risk for cognitive impairments, such as dementia, poverty due to limited finances, and then older adults are also at an increased risk for mobility issues. So low socioeconomic status is often equated with limited healthcare access. Essentially, people with lower socioeconomic status often have poorer health, and this equates to a greater need for healthcare resources for these individuals. We can view these disparities through the cumulative advantage-disadvantage framework, which essentially says that a lifetime of exposures and experiences can contribute to health disparities later in life. So, for example, people with lower socioeconomic status might lack access to healthcare earlier in their life, and this can contribute to health problems later in their life. Some socioeconomic limitations for healthcare for older adults can include things such as inadequate health insurance, financial constraints such as paying for medications or paying for copays, and having fewer healthcare providers in these low-income areas. Living in rural geographic areas is also equated with limited healthcare access. Your rural areas often have unique healthcare barriers that can include things such as transportation and travel constraints. For instance, you have to consider, is there public transport available in these rural areas? And then we also have to consider rural areas might have limited access to healthcare providers and specialists. Not many rural areas have many healthcare providers. And then we also have to consider access to buildings and neighborhoods in rural areas because older adults, they often have mobility issues. So is there wheelchair access or ramps instead of stairs or elevators available? These are all limitations that we really have to think about for healthcare access in rural areas. Limited healthcare access has also been equated with rising healthcare costs. It's been noted that adults age 50 and older have concerns with the overall healthcare affordability, and this affordability can limit healthcare access for older adults through things such as medication access. For example, some patients may not be able to afford a prescribed medication, or they may skip doses to save money. And then we also have to consider healthcare provider access and healthcare test and treatment access, because some patients may delay or skip doctor's appointments or delay and skip tests or treatments to save money. Some potential solutions for limited healthcare access for older adults can include things such as telehealth, which is the use of telecommunication technology for healthcare. This promotes communication with providers, and it can help patients with checkups and medication management without ever having to leave their homes. This works well for rural areas that might have limited transportation or limited access to providers. A couple other solutions can include Medicaid and Medicare savings programs. So Medicaid is public assistance that's available for low-income individuals, and it helps with healthcare costs. And then your Medicare savings programs are available for low-income individuals that are already on Medicare and can help with Medicare premiums. A couple examples include qualified Medicare beneficiary and qualifying individual. Moving on to part 2 of my presentation, when I envision my future self at 75 plus years old, I envision my lifestyle/living situation to involve living in the rural area that I currently live with my partner Michael. I also envision continuing frugal spending habits. Me and Michael, we have retirement pensions, but it is very important to know how to live below your means. When I envision my future health, I plan to stay active through gardening and yard work. I enjoy growing flowers and growing food. And then I also plan to continue meal prep with a lot of plant-based foods. In an article by Missouri Medicine, Klim and Barthel note that plant-based diets can improve cardiac health and other chronic conditions such as diabetes and hypertension. So I plan to keep incorporating plant-based foods into my diet. And then when I envision my future purpose, I intend to spend time with my family and friends and continue caring for my plants and caring for my home. When I consider my future health and well-being plan, for physical health, it's important to remain active and maintain wellness checkups. These wellness checkups can include dental exams, eye exams, lab work, primary care physician checkups. For cognitive health, it's important to continue learning. I really enjoy reading, both fiction and nonfiction, so continuing to read and learn in my future will help with cognitive health. Emotional health, I intend to continue my mindfulness practices such as meditation, box breathing, mindful stretching. Social connections, it's important to maintain contact with family and friends. And then once I retire, it's also a good idea to explore volunteer opportunities. This rural area has 2 different animal shelters and a library that have volunteer opportunities. And then financial living needs in the future. I have a retirement pension that will help along with my Social Security, and then I also plan to maintain my frugal spending habits. So when considering future barriers and adaptations, home adaptations for mobility issues are really important because falls affect older adults more than any other age group. So installing rails on stairs, taller toilets, and toilet safety rails are a good idea. We have a walk-in shower, but installing a safety bar in the shower would be helpful, along with including slip-resistant shower mats, essentially anything to mitigate a fall. Healthcare accessibility adaptations for living in a rural area can include things such as telehealth, which I mentioned earlier. We actually have excellent fiber internet in our area, so telehealth will work really well here. There is a public transport bus in this area, so that would be helpful to go to and from doctor's appointments. And then when considering rising healthcare costs, enrolling in Medicare Part A for hospitalization, Part B for doctor's visits, and Part D for medications, along with a supplement insurance for any gaps in coverage would be a really good idea. Moving on to Part 3 of my presentation, this is my reflection letter. Dear Jessica, your goal is to live a long, healthy life. To do this, you must stay active and maintain a healthy diet. Eating a plant-based diet has been linked to longevity, so continuing to incorporate plenty of plant-based foods into your diet will be beneficial to your health. As you age, keep going on walks, using your stationary bike, gardening, and doing yard work. Physical activity helps your body function well, so maintaining this activity will be beneficial. It is also important for you to maintain your preventative health screenings and checkups, so continue with your regular dental cleanings, eye exams, yearly lab work, and your yearly primary care physician checkups. As you age, you will need to add a regular mammogram and a regular colonoscopy to your preventative health routine. Emotionally, remember to maintain your meditation practices and breathing exercises to balance stress. Also, don't be afraid to try new activities such as yoga or Tai Chi to expand on both your physical and emotional health. Social connections are an important aspect of life, so maintaining your relationships with friends and family is an essential aspect of healthy aging. Also, don't be afraid to try volunteering at a local library or animal shelter in the future. Financially, you are very frugal with your money. Continue contributing to your retirement pension. Overall, just remember that maintaining your health encompasses multiple factors as you strive for a long, healthy life. Here is a list of references that I used, and this concludes my presentation. Thank you for listening.